My name is Katie Banerjee, 48 years old, and I've been cycling for about 4 years now. Just started cycling because I couldn't run anymore when I got arthritis in my hips, and found another way to find a pursuit that involved causing a little bit of pain to my body and keeping my fitness up. Then I started just doing charity rides, and then got better and better on the bike and wanted a bit more challenge, so found a coach and then started training and racing after that. So I've been racing for about 3 years now. I used to be a cross-country runner when I was younger at school, and I lived in the UK at the time, so sort of represented the county at that level, and then stopped running when I went to college and university, and then didn't start running again until I'd had my children. So they were younger, so probably about 35 years old when I started running again. Ran for about 5 years, and then moved to Australia and found a bike. Well, people sometimes say to you, do you wish you'd found cycling beforehand when you were much younger? And I thought about that, and then I thought to myself, well, probably not, because I don't think I would have done the other things I did in my life if I'd been cycling competitively since I was much younger. So overall, I think I found quite a nice balance. But I probably had a good base from my long distance running, and I've always been quite slim, so that really helps with riding the bike, particularly up hills. And I'm currently racing for a ladies team in the NRS, which is a new team this year, which is the KOM Knights of Suburbia racing team, and that's a super exciting opportunity for me. So I did race NRS just a few races a couple of years ago, and then in 2020 I just did sort of masters racing, and then the opportunity arose that I was approached to say, would you be interested in doing some more NRS racing? And I thought, well, why not? I don't think I've got the many years left in me, and I've been feeling really good and racing well at the moment. So yeah, pleased to be able to help out on the team and then use my skills to help the others in the team so that the team can achieve some really good results. I work for Sydney Children's Hospital Network, and I'm currently at the Children's Hospital Westmead in the Kids Rehab Department. So I'm co-head of the brain injury service there, and my job is a consultant in Paediatric Rehabilitation. So I'm currently working less than full time, but probably around 4 days a week, but with a little bit of flexibility within those days in the work. And my work colleagues have been amazing at supporting me, particularly during coronavirus, where we're all really looking out for each other with regards to mental health well-being and maintaining fitness levels. And so they've always been really encouraging with me. If I've got a competition and I need to swap some dates around, or I might be changing a clinic date, my secretaries are amazing at phoning parents and saying, can you come in a little bit earlier or a little bit later? And I think a lot of the families know now, so sometimes I'll say, oh, is Dr. Katie racing again? And they'll say, yes. So I said, oh, well, make sure you say good luck and we'll come in later. So the patients, the families and the staff have just been really fantastic at helping to support me. And then I have 1 day off a week, which I'll use as a sort of a major training day on that day. So that helps to keep a balance and allows me to be home in time to pick the kids up from school. So from a medical perspective, we haven't had a huge number of cases anyway in Australia and New South Wales, thankfully, and particularly in the paediatric environment. But having said that, we changed a lot of our systems within the hospital to accommodate the potential of coronavirus, and we're still, with regards to online meetings, and then we did a lot of our consultations via Telehealth. So fortunately, in our rehab department, we'd set up Telehealth a few years earlier, really to help those children in rural areas who had significant disability and made travel difficult, or potentially they were potentially fragile, and so it wasn't so good for them to travel long distances or stay overnight for long periods. So we'd set up a telehealth system anyway, whereby we were engaging local health professionals or maybe local therapists to be at home or in a local medical centre with the child, and then we would telehealth in from the hospital. So we were able to use a lot of the IT that we'd already set up now in a more formalised way, and our hospital has been really sort of at the forefront of supporting the IT telehealth services. So we've got a number of platforms that we've used to link in with parents from home. And so, for example, there was a time when I'd come back from Italy for racing the Strade Bianche just at the very beginning of coronavirus, and it was right on the cusp of where I'd come back, and I had to then isolate at home for 2 weeks, which was very difficult because I'd just been away for 2 weeks, and so I had a lot of patients that I needed to see, and I was able to do that via Skype for Business or Zoom or My Virtual Care, which is one of the platforms that we use, and I was still able to do my consultations from home, which was really quite amazing. The main reason that I'm able to do this job is because we work as a huge team with nurses, doctors, therapists, psychologists, social workers. We have child life therapists who will help to engage the children and perhaps make them feel more comfortable and relaxed around the sort of potentially painful or invasive procedures that they might need to have. And so because we're part of a team, we can debrief within the team if there's a particularly traumatic circumstances. And the children are often inpatients for many, many months. And so you really get to know the families and the children really well. And it is heartbreaking with regards to the amount of trauma that we see. But at the end of the day, children are very resilient. And we in the rehabilitation sort of department, what we're doing is we're seeing children coming in with a devastating injury and then improving to a point whereby they're able to go home and live potentially an independent life and get back to school. So actually, long term, it's actually very rewarding. But it's the difficult part is being able to support emotionally the family whose life has significantly changed during that journey that we travel with them. The old Bathurst route had a hill climb championships on the first day, and it was quite a brutal climb, and sort of people go at their max for about 10-15 minutes. And I'd completed my race and I'd already cycled back down to the start around Mount Panorama. Then I got a call by Glenn Viggers from Cycling New South Wales to jump in his car because he knew I was medical, and he zoomed me up as fast as I think I've ever been up Mount Panorama in his sports car to the top, where unfortunately a man had collapsed at the end of his hill climb, and he wasn't breathing and needed cardiac massage and resuscitation until the paramedics could arrive. I think we were there for about 20-30 minutes, and it was pretty hairy. It was probably more nerve-wracking than the actual hill climb itself, but the paramedics came. We resuscitated him, got a pulse back, started breathing again, and he actually came round and gained consciousness just before the paramedics arrived. I believe he had cardiac bypass in the next couple of days, and I hope he's back cycling again. I honestly think that life is a balance, and I really don't think that I'd be able to offer so much in regards to my work life if I didn't have another avenue of release and relief, really. And so I say to my coach, please, in my training schedule, can you just give me one day a week that you just call Ride As You Like, and then I can ride along and I can put my bone conduction headphones on so I can still hear the traffic, put my music on, and then when I get on a country road I can just ride as I like, and that's a huge relief for me. And I'll often do rides early in the morning before I go to work, and I'm actually much more efficient in my work if I've had a good energy release in the morning beforehand. I don't think you need to be a professional or in any sport or competitive cyclist, for example, to be able to find a relief. But even just keeping up regular exercise, and definitely for a mental state as well, I think is extremely important. The team that I ride for, KOM Knights of Suburbia, have a huge link with mental health charity, the Love Me Love You Foundation. So often the physical and mental health are so intertwined that even just doing something regularly, that might be walking around or walking to and from work, maybe doing a little run, any exercise that you can do that you feel comfortable with. But also mindfulness and meditation, I think, is really important as well. And stretching and keeping yourself supple to prevent injury and just to help to relax the mind, I think, is really important. I've entered Amy's just recently to qualify for the World Championships in 2022, which I really hope is going to be on. Again, it's back in Italy. And I believe it's a very hilly course with a mountaintop finish. So top of my age range, last chance I'm going to get to do the whole course, because women over 50 unfortunately can't do the whole distance internationally. So this is my last chance to do a big, long, hilly race. So I'm really looking forward to it.
And do you think you're getting better with age?
Actually, yes, I do. I think so. I don't know how much I can continue to improve with sort of strength, but aerobic fitness as well is still improving. And what I am learning is race tactics and bike handling skills. And because I was late to the sport, I think there's still a lot of room for improvement in those areas. And one of my new coach, Don Blackman, is certainly an expert in that field and is guiding me meticulously. In 2019, in St. Johann in Austria, they do the Masters Cycling Federation World Championships, which is a whole week of events, sort of a fun ride, 2 laps of a hilly course on the first day, and then they do a time trial, a hill climb championship, a sprint championship, and then they do the World Championships road race. And I had a fantastic week, when things just come together and you just feel on form. And I won every event, including, surprisingly, the time trial and the World Championship road race, which were the main ones that I really wanted to win. But I also won the hill climb and the sprint championship and the other road race as well. Yeah, dual World Championship from 2019, and I don't think it's been run yet since, so I was still the reigning world champion for 3 years because of COVID.